know when it's hot out here. No, I don't mind though.
But today I look at something very important. On the heels of it's the World Day for Family Physicians, celebrated, observed on the 19th of May. I've got some funky family physicians in front of me. Dr. Ernest Inimopari is with the Kolibu Teaching Hospital. He's a resident in family medicine. Next to him, I have Dr. Salamatu Atta Nantongma. She's with the Mamobi Polyclinic. Is it still a polyclinic? It's a general hospital now. Yeah, lovely place. I've been there a couple of years back, but it's a big place as well compared to others. She's a specialist family physician and also a geriatrician, right? Okay, they're joining me because today I'm considering and asking, do you have a regular family doctor that you see and you've been seeing over the years, or do you just walk into any hospital, any facility when you're unwell and see anybody the system throws at you? And what's the advantage of having a doctor who knows you, knows your history, knows your family over time? So today we're talking about family medicine and the role of the family doctor in improving your access to quality health care. Indeed, if you see somebody who knows your history, sometimes, they can even do a bit of poking their noses into your family business. But it all helps to put your health and well-being into context. So that's what we're talking about. Any questions, concerns, share them with me on WhatsApp. Doctors, you're welcome.
Thank you, Noti.
Family doctors. And, I love this whole area, this specialty, because, growing up in the UK, I knew we had a family doctor. You go to a practice. In other places, you hear a general practitioner, right? And it seems so impracticable in our part of the world that you have one doctor all to yourself, right? So I give you the opportunity to convince my listeners home and away that this is something that we can do. And I understand that family medicine has been practiced or in existence formally in Ghana for 20 years. Right. Okay. So hit me with it. What's family medicine first? Who's a family doctor?
Okay.
And then I'll be poking, the questions at you as to whether it's practicable.
Okay. So good afternoon to my host, Mr. Note, who happens to my lecture at a point in time. I have to acknowledge that since you become the general captain to...
I'm a general captain, right?
No comes. I'm quite interested.
Once in a while, I speak with the president, but here...
and then good afternoon to our listeners and our viewers and online. I must say, like you said earlier on in your introduction, 19th, which was last week Sunday, marked the celebration of the World Family Doctor Day, which was very significant in many ways, because as part of the celebrations, the doctors in Accra organized some medical screening for the inhabitants in and around Kolegon, whereas those in Kumasi did so with an area called Twasi, and it was quite fruitful. But to answer your question more specifically, it is possible. Many a time, people would think to have one family doctor means that you need that doctor to be with you all through. Actually, for the WHO, for instance, their recommended doctor-to-patient ratio stands as should be around 1 to 1,000, or about stretching it to 1 to 1,000, 320. It doesn't mean that at any point in time you are the only person or patient accessible to the doctor. What it means is that a group of people can be assigned to a particular doctor. So many a time people confuse it and say, how possible is it for one doctor to know my family? We don't have enough doctors in the country. But what we are looking at is a mapping where you have a specialist who is sort of mapped to a group or a population of people. So it makes it mathematically possible. So you have one doctor having maybe 10 families and seeing to them, rather than having one doctor to each family. Yes, so that's my explanation.
But it still means some regular contact, some very, very significant rapport with your patient, and some access to records, history, and so on over time. Dr. Nantoma, I mean, this makes sense, right? Somebody who knows you, maybe whether it's your reproductive health or your general health and other things, they know you over the years, right? And sometimes they even get to know your children, right? So how does it work? And how different is that from a regular doctor who's also being allocated, whether randomly or whatever, seeing patients? I mean, he sees patients as well. Is there any special training involved?
All right, thank you very much, and then good afternoon to your listeners. So there's a special training that goes into creating, if I may say, a family physician. And a family physician is trained to have certain qualities. So the family physician is trained to be a caregiver. You are supposed to be a decision maker. You are supposed to be a community team leader, a communicator, a researcher. And like he said before, if instead of our population is grouped into zones. In countries that this has been tested, like in countries like Brazil, family doctors have a zone or a community that they oversee. So each family doctor may be responsible for, let's say, 100, 200 families. And you work as a team leader with other health workers working with you. So you have other community, let's say community health nurses with you. You have other doctors to support the team. So you are supposed to keep an account of every patient or everybody within your catchment area. So at the end of the day, because of health records as well, you are able to still have some amount of contact and still be able to keep an eye on everybody within your zone, depending on which cycle or which stage of their life they are in.
So let me just try to understand this. So you do medicine, right?
Yes, please.
You've done your medicine, then you go and do further training or specialization in family medicine.
Yes.
Right. Why would a doctor want to do this? Why would you want to be a family physician, right? What does it add? Of course, in terms of professional progression or development, I can understand. But really, what's the big deal? Your colleagues who are not family physicians are doing the same things you do, right? But you have a bit more depth when it comes to how you relate to your patients. So why would you want to be a family physician?
I get that question a lot, even from some of my colleagues. And being in training, I think the medical training is such that whilst in school, you get exposed to almost every discipline or subspecialty. So all through medical school, after doing the basic sciences in which you do the anatomy, physiology, then you move on to the clinical aspect where you do general surgery, obstetrics and gynecology, internal medicine, child health. You get exposed to, and along the line, people decide to do one or the other as they go on. So those who are surgically inclined, even before they got to medical school, tend to have more interest in those surgical disciplines, which include, for instance, general surgery or obstetrics and gynecology. But for others, they take those decisions when they are exposed to it, the actual work. So you've gone through medical school, you still didn't have an interest, and then you decide, okay, when I did my internal medicine rotation, I think I had more interest and I'm tended to like that kind of subspecialty.
Okay.
I think for me, it's one thing that's individualistic. I can't point to one reason why everybody should be doing family medicine. I think for me, the fulfillment is that as an individual, it suits what I want to do.
Okay.
Where maybe, like you said rightly, I'm poking my nose into people's business, but I want to get beyond just knowing you.
Right.
And that's one of the ethics of family medicine, where you are not just treating the disease of the patient, you are treating the patient with the disease.
Right.
So in every condition, you are looking at the patient rather than the disease.
So your care is holistic.
It's holistic.
Right.
And the other thing is, whilst in my training, I never found an area which I could easily flow or find kind of satisfactory.
It's because you are not so full.
And maybe lastly, it's I think maybe yes, it ties into it. Maybe because I want to
You're calling. You're calling.
Yes.
But let's get my listeners to understand. And listeners, if you just joined me, I'm in the company of family physicians, right? One is a specialist or has specialized already. That's Dr. Salamatu Atta Nantoma. She's with the Mamobi General Hospital, right? And resident yet to what?
Yes.
Finish,
yes,
but
please.
practicing is Reverend Dr. Ernest Enim Opari. He's with the Kolibu Teaching Hospital as a resident in family medicine. Now, what I want them to share with you is, well, what are the benefits for the end users, the patients, okay? And would you even know that you're seeing a family physician, and does it matter? Right? Does it make any difference? In our dispensation, the ratios are pretty whack, if I can say that, okay? The numbers, and if you just look at the regular, typical OPD, outpatient, right? You see the numbers there. How are you going to practice this, and what do I, as an end user or a patient, benefit?
Okay, so we like to say that family physicians are the gatekeepers of our health care delivery system.
Okay.
So you get to see a family physician who takes care of you in every stage of your life.
Okay.
Coming to the question, can you tell whether you are seeing a family physician? I think practicing over time, patients are able to tell what kind of quality they get from a family physician.
Okay.
And they come back. And when a patient comes in to see a family physician, there are some things you are expected to have achieved by the time you leave.
Okay.
So you get to be treated for your immediate acute illness. So people go to the hospital.
Whatever you present with.
You are treated for. Family physicians are very particular about screening for what you didn't know about or what your risk of other diseases are.
Okay.
So by the time you leave there, your family physician, you are able to tell what are my risks.
Okay.
And if any of them are manifesting already, and what should I do about it? There's that comprehensive aspect of seeing a family physician. We refer appropriately and promptly.
Okay.
So by the time you finish seeing a family physician, your care is actually coordinated, and you get to always go and come back. Okay. With family physicians, you realize that they open their doors to the fact that, okay, I'm sending you out to see another specialist, but my doors are always open for you to come back to ask me questions or for you to come back to continue care.
So in a sense, your family physician becomes your anchor.
Exactly.
You can be referred to other people but you come back to this base where all the information about you is put together in a coordinated way.
Exactly.
So let's say, for example, you're seeing somebody from a family that has a history of diabetes or breast cancer, and they are not aware, right? Is it your duty, therefore, to bring this issue up and to lead history-taking investigations to actually alert them and perhaps prevent the occurrence of this condition?
Exactly. So if I saw a patient who came in with malaria and during my history taking, I should be able to pick up the fact that the person has a high risk of breast cancer or diabetes in their family.
Okay.
I should be able to assess the person to say, what is your risk now of getting the disease? Do you have the disease? I should be able to educate you to be able to pick up what danger signs you need to look out for in case you are getting to it. So at the end of the day, you are able. At the end of the day, I should be able to tell you that I can treat your malaria.
Okay.
But however, these these things are things we need to keep our eye on, and you need to come back every now and then to be able to so that we can assess to make sure that you do not get into late forms of those diseases.
Okay, great. 22 minutes past the hour of 2 on Joy 99.7 FM. The program, as always, on a Sunday afternoon after 2 is Ultimate Health, your ultimate guide to healthy living. Healthy living is even, more enhanced and facilitated if you have a family doctor, a doctor that knows you, knows your family, knows your community, knows the context in which your condition sits. And I've got 2 of them, thankfully, in the studio, and we're discussing that. I've got this up on my screen from Sam Saki. He says it would be nice for all the family to visit a particular doctor or health facility for medical care. I'll look forward for such hints. That's what Sam Saki sends to us. I've got this here. Let me see. This one says, Note, my family doctor is Prof. Lassie of Kolebu, my gynecologist, and Dr. Augustine Kwashi. Oh, Augustine, I haven't heard of him in a while. Tema General Hospital is my physician. They have been my family doctors for a long time. So when I have a problem, I have a challenge with my health at any time, they at times prescribe medications for me when I narrate my problem without actually going to the hospital. God bless them all. This is shared by Senam. Senam, thanks for sharing that. Augustine Kwashi, I haven't seen you in a while. You used to be a regular on Ultimate Health many years ago. Get in touch. Right, so people are sharing that they do have this experience, but perhaps maybe they would not have labeled it as such, right? They just feel that I have a particular or a unique relationship with my physician. So let's look at the relationship part of it. Is it that you deliberately build this rapport and this partnership with your patients as family physicians? Is it that you go out? Dr. Enimapari?
Yes, so what we have is what we call we are levels of care.
Okay.
So when a patient comes in, we have 5 levels. There's a level where the patient is largely the recipient of the care you are giving out. For instance, if somebody came in with sudden onset of abdominal pain in a certain area of the body, lower quadrant, right quadrant, and you think more like appendicitis, even though you're a family physician, that is an emergency.
Okay.
So under the setting, you are supposed to explore mainly that particular consideration and later go on. So immediately. So that's like the patient is largely your focus of care. Okay. Then you have your level 2 where the family becomes a partner. So this is a case where maybe somebody has hypertension, but the wife is aware. You want to, that's upon disclosure, having gotten the consent of the husband.
Okay.
You want the wife to be aware. Then you make that clear, because sometimes the wife will interpret the antihypertensive or the medicine the husband is taking as going to affect, usually it's a complaint that some women have, to affect the man's ability to function sexually.
It's not just a complaint of the women.
Yeah, the men have it too.
The men will tell you that if it's going to bring doomsday, then please.
Yes. So then that's your level 2.
Right.
There's another case where level 3 is when both the patient and the family are recipients of your care. So you're looking at a case like maybe a family with infertility, a young couple with infertility. You're not going to treat just the husband and leave the wife, because if you did, anything that you said will be misinterpreted or miscommunicated. Then another case where we come in as family physician most often is when you go beyond the hospital setting and visit the family in their homes. That is level 4. And level 5 is when you expand it a bit. So we don't go all out and say, you come with a headache, you are vomiting, and I want to explore this because I'm a family physician. I by all means have to kind of get all the details. Depending on the situation, depending on the diagnosis and the setting, we tend to adopt a certain level kind of care. But eventually our ultimate as family physicians is to get to level 5, where, like you said, we come in contact with your family, know them for who they are, assess the risk, like my boss said. But just to chip in something, the reality on the ground is that, like you said early on, the number of doctors we have already are not enough. And so it will be not too accurate to say that we can give that kind of care.
We can't even zone and do catchment areas.
Yes,
you see.
But the admission that my thought is that, in addition to all we are doing, one of the differences between what we do as family physicians and other kind of specialists or doctors is that we use specific kinds of tools. So in addition to the levels of care that I shared with you, what we also do is that, like an electrician will come with maybe some wire, something to test. When we assess you, all things being equal, we have tools that we explore. So somebody comes with a headache, and I remember I had a patient like that, came with a headache, checked the blood pressure, explored for possible stresses, anything that could precipitate the headache. It didn't happen that way. So we have tools like what we call the exploring the illness experience. And then we use maybe, what are you thinking? What is your worst fear?
Okay.
What ideas do you have about the symptom that you are complaining, the headache? How has the headache affected your function, whether biologically, socially? And what are your expectations of care?
Okay.
This is not used every now and then if you are not exposed to the tenets of family medicine.
Okay.
And by using that tool alone, I got to diagnose this patient of depression.
Right.
But if I had gone straight to the books and had gone to headache, would have given just my paracetamol, has no blood pressure.
You're making me happy.
It will just be simple. So those are practical tools that we use to explore the underlying diagnosis.
Great stuff. I'm getting Peter McCarthy Hill says, Note, what is out there is that family physicians are only for the rich families. The poor can't have them. They will make time for the rich families and listen to them and maybe visit them. Charlie, if you are in some lungus in some Russia Sukura back there, will Dr. Salamat Nantongma come and visit? But these are practical things coming from our listeners. Hang on. Let the people speak.
Sure.
Missionary Richard Abuaji Botre says, the truth is the average Ghanaian family doesn't have one. How do we have access to one, and how cost effective is it? Right? So I'm bringing the families to you through the power of radio, because these are real questions. Exactly. You know, living outside or living abroad, UK specifically, I knew hospitals, schools, social facilities and amenities had catchment areas. So you don't travel all the way from this place because this school is the only good school. So it speaks also to a certain proportionate or proportional allocation of resources across the country, such that there are facilities that are, at par. But where facilities are not at par, people migrate or gravitate towards the hospitals where the doctors are, even if they have to queue. Mm-hmm. Right. So this is where the practicality and sustainability or cost effectiveness of this comes up, and my listeners are bringing that. What do you say to that?
So, I understand where the person is coming from, but I work in Mamobi General Hospital.
I know.
So, family physicians are not only for the rich.
Right.
And when we think about even our team, when we talk about the improving access to quality health in Ghana, anytime you talk about access, we talk about affordability.
That's right.
And equity. And we are trying to say that family physicians are best suited to be able to meet all of these needs, because you get to see a specialist who has enough experience and knowledge to be able to see you at an affordable price.
Okay.
So the plan is for us to work towards having a family physician, at least in every district hospital in Ghana, to be able to have a family physician in every private practice you have in Ghana. Okay. Or when you walk into any primary healthcare facility, you should be able to meet a family physician.
Right.
The proportions are not the best now, actually. But really, family doctors are not only
not
for
the best
rich.
Even after 20 years.
Well, the first 10 years of the training was quite slow. We spent time with trying to get people to understand what the specialty was about and what it could offer for our healthcare delivery system. So actually, there has been a very rapid growth, at least in the past 10 years.
Right.
But in the first 10 years, it was quite slow. So I think we are gradually getting there.
Okay. I like to push policy, right? If it's good, research suggests that it's good, and the family, the end user benefits. Do we have policies that really push for this and demonstrate, the commensurate or, adequate resourcing for something like this to really make an impact in communities? You mentioned earlier on you are decision makers, you are community leaders, right? And therefore, if you have that connection with your patients and clients, then they will look up to you for some of these policy directions and, impact. Do we have that? Does the Ghana Health Service or the Ministry of Health push family medicine in the way it should to make sure that the population gets the benefits?
I'd say yes. Currently, the family medicine program that is run by the Ghana College of Physicians and Surgeons is one that has been there, like she said, and for someone like me, I'm being sponsored by the government of Ghana for this program. So I think it's a step in the right direction.
So there's scholarships.
Yes, there's scholarships for
available for doctors who want to specialize.
Yes. And secondly, there is an innovation by my leaders of my faculty where they are running what we call the modular program, in which case where you have doctors maybe in the outskirts of the country, maybe Navrongo, Sunyani, Techiman, they can't come down here because you are looking at a doctor population that is even deprived already. So if you brought the person down to Accra or Kumasi, you are further going to make the case deplorable. So what they do is that you stay where you are, but you are given modules to study and assessed intermittently. So I must say that those are interventions that the government has put in place, even though we can require for more because on the ground the numbers are not enough. But I must also say, with the question about the rich and the poor, getting service from a family physician like my boss, Dr. Natongma, is not charged separately. It's covered by the NHIS. So if you are an NHIS holder and you went to Mamobi General Hospital and you said you wanted to see a family physician and there were two of them, you don't pay extra for seeing her. And like I said, there are levels of care. So as long as your care is being given in the hospital, it's covered by the NHIS. But if you want to go ahead and for her to visit you under different circumstances, that's different. So it's obvious that the NHIS has its limits. But it's
I can request for her to okay. I'm well already. 33 minutes past the hour of 2 on Joy 99.7 FM. If you've just joined us, thank you. We're talking about family medicine and what it really is and how it benefits you. Whether, it's better to have a doctor who knows all your history, knows about your community, where you come from, what you do, the kind of work you do, the kind of hazards you're exposed to, your beliefs about even your health and wellness, right? All that rolled up into one doctor who is with you over time, hopefully. If somebody doesn't poach them or they don't get posted or they don't run away to another country, that's the model. That's what we're talking about. If you want to ask any questions by WhatsApp, is 0244 340 437. Shortly, I will activate the phone lines. We're live on Facebook and YouTube, so tell a friend. I've got this from Senam, who says, my other family doctor, okay, she shared Prof. Lassie. Hey, Senam, now you're creating a shortage, right? Is Dr. Sefoga of Lekma Hospital, Teshi. Also, my gynecologist, he has also been my gynecologist, I guess. He has been of tremendous help to me and my family. God bless you, Dr. Sefoga of the Lekma Hospital. All right, Senam has a good dose of family doctors. This one, I think is from Germany. Jeffrey in Dortmund says, what should the family that has its members spread all over the country do in respect of family doctors? All right. I guess I'll bring it to my guest, but it probably will be an aggregation of the history and the data, not their physical presence. Yeah. But I'll ask them to answer that. Dede in Maryland. She's up. Okay. If your family doctor is indisposed, license revoked, ailment, death, etc., that he cannot practice, can you request your records to be transferred to another new doctor? This is from Dede. Right. Over to you. So with regards to families that are scattered and then this angle that Dede introduces.
I think with regards to families that are scattered, the most important thing is to know what exactly you are doing for each person in the family. And it's always, family physicians are always open to coordination of care.
Okay.
So you could be in another part of the country, but your health will be coordinated between the family physician you are seeing and then the other family physicians in the other towns or cities that you live in. So that one can be coordinated easily because that's part of the duty of the family physician as well.
What about this aspect of requesting your health records from your family doctor, your personal file and records? Is it really yours?
Yes.
It is.
Yes.
You can request it.
You can request for your health documents to be transferred to another doctor.
Okay.
Even sometimes your doctor doesn't have to be dead or anything. You probably don't think that you are comfortable with that doctor anymore. Okay. You can request for your health records to be transferred to another doctor for you to continue care with a totally different
That's covered.
Doctor. Yeah.
All right. Great questions from my great listeners. If you want to send yours, 0244 340-437, Ultimate Health on Joy 99.7 FM. We're looking at this concept, this discipline, this specialty of family medicine, family physician, or some may even say your GP. Right, in other parts of the world, depending on where you are, right? Have you experienced this? And do you get the feeling that the people are referring, the doctors and physicians referred to, are they really family physicians, or just that people have this bond and long-term relationship with them? Right? Because somebody talking about her gynae, I can imagine you being very close to your gynae and, retaining him over time unless something very bad happens. Does it, are these known family physicians or to you?
So, well, these are not known family physicians, but I think family physicians are open to really any specialty who wants to use the unique characteristics or the qualities of a family physician to see a patient. That's the most important thing, that the end user has that quality care that we are looking for. So the person does not necessarily have to be a family physician, but as long as you are going by the qualities of a family physician, I think it's perfect.
Okay. Linda, and also been a while. How are you doing? She says she wants to know, family doctors, how are they paid? Is your pay different? Do you get different incentive packages for doing things your way? You both smiled.
Okay, so the truth is, as a resident, you earn the salary that your other colleague residents will earn, irrespective of their specialties. Just so, like my boss here, he earns the same as other specialists in other fields too. So they don't earn differently. There's no kind of difference. But of course, when you do more outside your patients, like I say, then you can take, depending on your arrangement, but you don't take more because you're a family physician. It's just standardized for everybody.
Let me ask it this way as well. Does it transcend or does it cross public-private boundaries? Are you going to get family physicians in the private sector?
Yes, so there are a couple of private facilities that do have, and those who have their own tariffs. So I'm aware, like you asked, so some private facilities have acknowledged that there's a difference between a family physician and then any other doctor. So if you went into a private facility and you asked for a family physician, you may probably be shown different rates for seeing a family physician and seeing another kind of doctor, as it were. So the charges won't apply for, but like I said earlier on, if you are going to a government public facility, then you are sure that your NHIS perhaps would cover for the service, irrespective of who is giving you the care.
Okie dokie. 39 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living. This and every Sunday, 2:05, we're live with all the up-to-date, precise, unassailable health information. Today, we're talking about family medicine with the family physicians in the studio with me, Dr. or Reverend Dr. Ernest Enim Opare. He's an Osofo as well. Is it with Lighthouse?
Victory Bible Church.
Victory Bible Church. Yes, right. Osofo and a doctor. Right. Religion and health. And next to him, I have Dr. Salamatu Attah Nantongma. She's with the Mamobi General Hospital. She's also a geriatrician. Right. So you specialize in healthcare of the elderly.
Yes, please.
Right. How many of you are there?
Okay, so geriatrics in itself is quite
a whole area.
A new area of specialty in Ghana.
Really?
So for now, we have about 4 residents in training.
Uh-oh.
Okay. But of course, there are a lot of family physicians who have practiced in years past.
Because you need to understand the elderly and their conditions.
As geriatricians.
Wow.
And a lot of times, a lot of patients or a lot of people have grown with their doctors as well, who have acted as geriatricians. So we have a lot of doctors who are actually practicing geriatrics, but the specialty is quite a new specialty in
Hopefully they
Ghana.
They outlive their patients.
Hopefully.
Right, but the care of the elderly is a whole thing, right?
Exactly.
I handled one case where an elderly woman wasn't eating well, was refusing food, right? But we had to go in there and do a multidisciplinary assessment.
Exactly.
But her dental, should I say, status, if I can use that, meant that she found it difficult chewing, right? And so eating was a whole pain for her. But nobody thought about her teeth, right? And her dentition and whether it had an impact on this refusal to eat, right? So we'll be getting into geriatrics very soon, but in other conditions, right? 42 minutes past the hour of 2 on Joy 99.7. I must say this is very, very, very interesting and challenging because of the circumstances in which our healthcare delivery system finds itself. And it hasn't changed that much, but there has been some growth. So if you have any questions, concerns, I'm going to activate the phone lines now. 0302-216-541, 0302-216-541. So you can talk to my family physicians. They're very friendly, especially on Sundays. They're very friendly, and you can ask your questions, right? But let me share something from my side or my discipline. We get very close to our clients as psychologists. We get a lot of information that sometimes they don't even share with their physicians. This issue of confidentiality. So maybe a partner, a spouse has told you this. The other spouse is unaware. You are the family physician. How do you go about bridging this without causing a tsunami in the house or the home? Sometimes, like you mentioned, to do with fertility or infertility. I handled a case some years back where I think one partner had been given the feedback that the whole problem is from your partner, right? So the fertility issue became a blame game, right? How do you balance this confidentiality and sharing and being able to access a pool of information about a family or a patient?
So like my colleague mentioned earlier, I think family physicians, one of the things we use a lot are tools that we use to assess our patients. So like he said, sometimes assessing just the illness experience of the person allows you into the person's thinking of what is going on. And sometimes you are able to let them know that the things that they look at to be so huge are probably not a problem as they look at it, because you have been able to delve into their illness experience. There are other tools we use to measure family functionality. So when you're able to tell what the family function is, sometimes
almost like a needs assessment.
Exactly. You're able to, so it helps you to be able to get into who to talk to, who to help probably get into this issue. And sometimes there are times that people don't realize that the fact that you keep the information to yourself makes it difficult for us to solve the problem. And just explaining it with these tools allows the patients.
Great. My family is expanding. I have Ajiman on the line. Let me bring him in as a family member. Ajiman Joseph.
Yeah, boss. Good afternoon.
Tema Community Ahin.
Community 9.
You listen to every program on Joy. One of these days we have to do tilapia or something, okay?
Yes, sir.
We'll do something very healthy. Share with us.
Yeah. I want to ask. When you go to hospital, we have our folders, we have our health history over there. And in this case, when we have been entrusted our health into a family physician, how is that one also being done? And secondly, if let's say we are about 4 or 5 and one of us is attending SHS at, let's say, Cape Coast, and from Accra, the person has left for Cape Coast is not with us here unless they vacate. How does that person's care being taken with the family physician?
Okay, so if I get you right, your first question has to do with confidentiality of your records.
And how to get my folder and my history so that we will follow us at when we know I was suffering from this. And today this.
All right. I think Dede's question answered, or the response to that answered that, but they can go over that. And then he's talking about the scatter again. So if you could just go over that.
I think I understand where he's coming from because of the issues of how our health records are being managed right now. Because in the past, we've used a lot of folders. And people always have the issue of their folders getting missing and all that. But now a lot of hospitals are going into using electronic record keeping and data and all that. So over time, you are still able to follow up the data and people's information. So that doesn't become a problem anymore. So that is being improved. And the scattered family members all over the place. The reality is that a lot of times, all the family members don't need an acute care all the time. So it's just continuum care that they need. So anytime anyone is available, or the example he gave, you have a child who is in school in Cape Coast. When the child is on holidays, he comes to see the family physician. You talk to her about what's happening in school, how are you coping and all that. So you're able to pick up some things that they could be dealing with.
So if a family physician, for example, knows that I have a teenage daughter, Would they suggest to me, have you looked into sex education, this and that and that and that? Would they be asking about her reproductive health because she's, crossing from adolescence, puberty, etc.? Would that be something that you'd be getting into? Or?
Yes, actually, some of the subspecialties under family medicine includes adolescent health.
Okay.
And currently there are doctors who are family physicians who have entered into that area, who take particular interest in that area. But so as a family physician, you have all of this. So the family evolves from when you are alone, you are single, you become a couple, you have children. The age of the children are below 5. When they are growing, when they go out of home because of marriage. So at any stage of the family, there are peculiarities that the family physician is trained to look out for.
Okay.
So it falls fairly within our scope.
Okay. Let's look at this decision-taking or decision-making again. So maybe from my circumstance, my situation, and my health records, you want to suggest that I do some form of maybe permanent or most significant or serious family planning. Right. It's an interest. It's in my interest. But I don't see eye to eye with you. How is that handled?
So issues of decision making, you really need to know where the patient is, as to how much information the person has about what you're talking about.
Okay. Do they understand?
Do they understand? What are their plans? What are their next steps? How does what you are suggesting affect their life?
Okay.
And sometimes when you go through all that, patients get to understand that this is for my health benefits.
Okay.
And I mean, like you said, you can partner with family members. So in this case, are you going to partner with the husband?
Okay.
Or you're going to partner with the mother? Or you're going to partner with the children to be able to achieve your goal, or a goal that will improve the wellness of your patient?
Okay. Right. Is there a fee cost for transfer for a document or to a transfer to a new doctor? Can my new doctor do the record transfer request instead of me, the patient? Dede in Maryland sends that again. So you mentioned that you can access your records, you can request to move to a new doctor. And she's asking whether there's a cost for that transfer and whether the new doctor can request your information from your old doctor.
I think different modalities work for different places, different countries, and then different institutions. But with the health information, the most important thing is for you to request for it, or for your new doctor to request from the old doctor.
Okay.
Probably the information going from maybe a private practice to a government institution may be different, may come with some charges.
Okay.
Or yes, sometimes some doctors may charge an amount for putting your health records together to pass on. But to a large extent, a lot of times it's actually free for you to get those.
All right, we've got about 10 minutes to go. My phone line is still active, 0302-216-541, 0302-216-541. Ultimate Health on Joy 99.7 FM. You know my name, Norte by nature. I'm with Reverend Dr. Anim Opare and Dr. Salamatu Atta Nantoma. Where does the Atta come in?
Okay, so Atta, I'm not a twin. I get that question a lot.
Right.
So Atta comes from the Nanumba tribe.
Okay.
So, and it's a name. It's not it's for a twin. So that's it's a name.
Right. I've been wanting to ask that. Those of you sending me videos, I can't do videos during a program, okay? So that's not going to happen. 0302-216-541. So you celebrated the day again this year. You've done some screening and so on and so forth. A lot of my listeners, when we observe these days, tend to think, well, it's just restricted or localized to these observances, and then you all go back to sleep, and then you come and appear in lovely T-shirts as you are now, and you don't give me any. And so what really is going to happen? Are we supposed to feel this kicking in or being more, should I say, evident or salient in our health systems? Somebody asked somewhere, I read, whether FP or I guess family physicians influence health policy.
So to begin with, starting from our celebration. So you're right, we did some programs to...
Okay, let me just quickly take Jackson on my line. Hello, Jackson.
Yes, no, good afternoon.
Hi, how are you doing?
Fine, thank you.
Okay, share with us.
Yes, please, I missed the program. I didn't listen from the beginning. I just tuned in right now. I saw your Facebook post. Like, I wanted to start with you, but I missed the program. I want to ask, are they having any package for family and how much? And if somebody wants, how the person will get them?
What do you mean by package for family? Can you clarify? Just clarify.
Yes, I'm saying something like they have insurance or something. If a family wants a doctor from them, how much is the charge and how can I get contact to them?
Okay. Right, he has a family member already chipping in there.
Yeah.
Right.
Okay, to answer your question, the earlier question. Mm-hmm. So, with respect to the celebration, usually leading to some period of dormancy, and then all of a sudden there's this kind of reactivation. The truth is that things are better. So, what we do these days is that after the celebration, I mean, like something like our health screening we did at Kolegono, we saw over 300 people. Okay. And some of the adults we saw, we picked up. Out of every 4, we had one of them having hypertension who has either been poorly controlled or stopped altogether. And what we did was that we followed up such people at the polyclinic. Okay. Given that Kolegono is very close to Kolebu, we continue giving the care, and the plan is for some others who were screened for hepatitis B who didn't have the condition. We followed up with a scheduled kind of vaccination program, which we also offer at the polyclinic. Right. So it's a continuum. Okay. And the other thing about how family medicine shapes or influences public policies, what we see health to be, and globally what is being done, is that we don't see health to be more of a retroactive, or it's more proactive. Right. So one of the first things we do is to prefer education, and give preventive medicine. Primary prevention. Yes, so we are trying to do more of primary prevention. Then going into the tertiary prevention, where you treat complications and everything. Like Dr. Nantongma just said, we are the gatekeepers all across the country. They are only, maybe you're talking about teaching hospitals, you're talking about Kolebu, you're talking about Cape Coast, you're talking about Komfo Anokye, now Volta region, and then Tamale. But we have only 5. Most of the other hospitals fairly fall in the domain of either primary or secondary caregiving. So when you tabulate as a family physician, you sit at your OPD doing your morbidity and mortality meetings, you get to know that the top 5 causes of morbidity at the OPD is hypertension. Right. That shapes the kind of interventions. Yes, and then you give that information to the health authority. Okay. So we are the gatekeepers, and we have up-to-date information about what is going on even before it escalates. All right, I've got Jennifer on my line. Jennifer, good afternoon. Hello, Jennifer. Hello, Jennifer. All right. I guess Jennifer's gone for a family meeting. They sent this one. It says, Doc mentioned electronic record keeping. Is it well secured? Do the doctors doing this have invested against hacking? Okay, is there protection against hacking of electronic data? All right, Jennifer's on my line now. Hello, Jennifer.
Hello, Noto. Good afternoon.
Good afternoon. How are you doing? Hello. Uh-oh. There's a poor connection, I guess. Jennifer, try and see if you can get in before we wrap up. So, electronic data and its protection.
I think data management...
She's back? Hang on, Jennifer's back. Hello, Jennifer. Hello. Say it quickly.
Yeah, I'm saying if you have a doctor who is a gynae, can that person be your family doctor?
Yeah.
Hello?
Yeah, got your question. Is that the only question?
Yes, please.
Okay, great. Thanks for sharing. Yeah. So can your gynae be your family doctor?
Yes, your gynae can be your family doctor as long as he's giving you continuous care. Okay. He's coordinating your care. Okay. He's able to treat the acute cases that you present to him with and refer appropriately. Okay. Your gynae can be your family doctor. Okay. If it works for you.
Right. Let me see. We're quickly running out of time. Please ask for me how they handle the difference that may occur in terms of cost. Ask every doctor and his or her charges when they may need to hand over to a different physician. Ajman Joseph wants to know. People are very, very, very concerned about costs and charges.
Once again, like I said earlier on, when it comes to cost, for those who come to the public facilities, it's determined by the government. So a doctor like myself wouldn't dictate how much you are charged. And if you are covered by if you are hooked onto the NHIS, it's covered. You don't need to pay extra when you see a family physician. Okay. Okay, so
right.
I think.
All right. So if it's a public facility, it's the regular charges, right? OT is on my line also, I think, from Tema. OT, good afternoon.
Good afternoon, OT.
How are you doing?
I'm fine.
Right, share with us quickly.
Yeah, as for I don't have a family doctor, should I pick one?
Can you choose? You want to choose one and declare him your family doctor? Or?
He said...
Do you want to choose one? Is that what you're asking?
Yeah, because I don't have a family doctor.
So when you go to hospital, you see whoever's there?
Yeah, I see the doctor. Half my life, I'm 43 now, but I've been in hospital for 3 times.
Okay.
That is the whole thing. So I don't have a family doctor who said he's a family doctor. I'm sick. No, because I'm not sick just like that.
Okay. All right. Yeah. Let me put that.
Should I go to hospital and pick someone, or then in doctor? Should I say I'm to my family doctor?
Okay. Right. Can I come to you and say I want you? Right. I want a family doctor. I listen to Norte on Ultimate Health Joy 99.7. I don't get sick that often, but now from your discussion, I feel I should have one. Is that done?
So the truth is, because of the numbers, sometimes it's quite difficult to walk to a place and say, I want you as my family doctor.
Okay.
But I don't think that if you walked to any doctor to say, I want you as my family doctor, they will refuse. As long as, because the person sits in the hospital to work anyway.
Okay.
So you come to see me as and when.
Right.
We plan your health care over time and then you are seen. So, yes, and I think that it's where we want to get to is the fact that Ghanaians should not only go to the hospital because they are ill.
Right.
You should go to the hospital and have checkups being done.
To prevent illness.
So you hear a lot of times people say, I've never been to the hospital before till I was 60 or till I was 50.
Okay.
But a lot of the things you are managing at that age is because they weren't picked up earlier.
Right.
And you get them when they are in their late stages.
So a thrust or an emphasis on prevention, awareness, screening. Right?
Exactly.
And therefore mobilizing health promotive behaviors. So your family doctor will be helping you actually protect your health, right? And securing it, right? Yeah. Whilst also being there for you when
you are acutely ill.
Unfortunately, you do fall ill. They'll be there for you as well. All right. 59 minutes means we got 1 minute till touchdown. I can tell you that Sunday Rhythms is coming up immediately afterwards. But what are the words or message that you want to leave my listeners with? Before you go dormant again for a year.
We promise we won't.
So this time we are not going dormant for a year because we had objectives for the for the celebration. So we are helping to push the government and policy makers further to make sure that we train more family physicians. So that we can have family doctors everywhere. It's important that you take charge of your life. You need a family physician. You need to have someone who gives you continuous care. You need to go to have a yearly medical exam done. Everybody must have a yearly medical exam so that your health maintenance is done well.
All right. I'll see how next week goes, just to show that it's a continuous relationship. Man. Maybe I might drag them in again next weekend to go more into the practicality of this as well. But you've been listening to Reverend Dr. Ernest Enim Opare of the Korle Bu Teaching Hospital. He's a resident in family medicine, and also Dr. Salamatu Atta Nantoma. She's a specialist family physician and also a geriatrician with the Mamobi General Hospital. We've been talking about family medicine and how it improves your health outcomes. The key takeaway for me is that, look, don't wait till you're ill or sick, right? Go to them and help them help you to pick out and prevent disease, illness. That's the main thing. Thank you once again for coming. Many thanks to my producer, Abeku San Kofi, who he's been to Korle Bu a couple of times. Do you have a family physician? What was the name of the doctor you saw? Papa no. That's the thing. Well, okay. Well, thanks again to my producer, and of course to you, my discerning listeners. We hope this has informed and indeed transformed you. We'll be back next week with Ultimate Health. My name is Norte by nature. Been a pleasure. I'm out.
Every year, thousands around the world receive impartation from the biggest gathering of pastors, leaders, and business leaders to impact their generation. The Supernatural Empowerment Summit This year, come and receive an impartation from these great men of God: Bishop Tudor Bismarck, Zimbabwe; Pastor Ayo Orisejafo, Nigeria; Apostle Professor Opoku Onyina, Ghana; Apostle Sam Crunchy Ankra, Ghana; and the host, Bishop Charles Ojinasari, Ghana, under the theme Power for the Last Days, starting Monday evening 27th May to Saturday morning 1st June 2019. Join us for the evening sessions at 5:30 p.m. and morning sessions starting Tuesday 8 o'clock a.m. at the Paris Dome, Jolly Junction, Accra. To register, visit www.stsummit.org. It's the Supernatural Empowerment Summit. Come and receive power for the last days.
The long football season comes down to this: the one game that decides the kings of Europe and the kings of commentary keep watch.
Divock Origi has produced the magic. What a comeback! What a turnaround! Dele Alli with the ball. Lucas Moura!
Club Scops booked their place with a famous comeback against Barcelona. Pochettino Spurs recovered from a first leg deficit to win 3-2 at Ajax, but the Royal Tussle